ADAP is also in every state.
Whichever stereotype you're going to try to put on me isn't going to fit. That's for sure.
Because there's no stopping me.
Ask your healthcare provider if Biktarvy is right for you, and visit Biktarvy.com to view the important facts, including important warnings.
HIV over 50 and getting into care. That's what we're talking about today. Javier Perea, he's a benefits specialist from APLA Health, joins me on this Plus Talk. Good to see you, Javier.
Good to see you too. Thank you for having me.
Thank you for making the time. I think life with HIV for those over 50 really does come with its own unique set of challenges, doesn't it?
Yes, it does.
What are some of the challenges and options available?
Well, in general, people, as they get older, they need more health care than before. And then if you have a pre-existing condition, you will definitely want to have coverage. Sometimes some are well aware, but the majority are not. They don't know the resources that they have available. Being positive, there's quite a lot of resources, and it's all about meeting the guidelines or the income guidelines so that they can access the services that they need.
Let's break it down a little bit. We've got Medicare. How does Medicare work if you're over the age of 65 and living with HIV?
So basically, when you reach 65, it's automatically given to you. So it was intended to be for retirees. But if you are at any age become disabled, you will wait 2 years after you've been disabled or deemed disabled by the Social Security office to access Medicare. So because it's a program, again, that is intended for retirees, once you're disabled and you wait 2 years, it's automatically giving you access to it.
Now, does acquiring HIV classify you as being disabled?
So nowadays, HIV itself is no longer a disability because, with treatment, people are living longer and healthier, so they still have to go through a disability process, which is through the Social Security office. And it's a conversation that people have with their doctors, whether they're able to work or not. But HIV itself is no longer a disability.
Okay, so just break it down. How does Medicare work? Okay, I'm over 65. I don't have health insurance. I automatically get Medicare, but I got to get on my treatment, or how does it come together?
So in general, when you turn 65 and you have an address, most people have a way to be contacted unless you move, you have a stable housing. The Social Security office has access to your information, and that is connected with Medicare. Medicare will reach out to you, letting you know, hey, you are eligible to sign up for Medicare. This happens 3 months before your birthday, your 65th birthday, and 3 months after. So it's a total of 6 months so that you don't miss that time frame. Mm-hmm. And it's basically just knowing that when you turn 65, you can access it. But let's say you're disabled and you're 45. So normally, we hope that people have some type of a connection through the Social Security office or Googling, when can I access Medicare? So after 24 months being disabled, they are eligible also for Medicare. So whichever comes first. Let's say you become disabled at 64, so you're obviously not going to wait 24 months because your 65th birthday is going to be in 12 months.
Right. Okay. What about Medicaid? What is Medicaid, and how does that work for older folks with HIV?
So Medicaid is a state-funded program, and in California it's called Medi-Cal, hence the word Cal. So basically there's two types of Medi-Cals. One is based on income. So if your income is below 138 federal poverty line, which is roughly about $20,780. If your income is below that, you automatically qualify for Medi-Cal. If your income is higher than that, that's when you're required to buy private insurance. So that's the Medi-Cal based on income. Then there's other Medi-Cal is based on disability. So let's say you became disabled and you are yet not approved for Medicare, but you are deemed disabled, then you can apply for Medi-Cal. So two types of Medi-Cals.
Right. Can you have coverage from both? And if so, how does that work?
Yes, so then you can have Medi-Cal when you are disabled, and then you can have Medicare. That's what it's called, Medi-Medi. But it's all based on income. So let's say your income for Medi-Cal is $2,000 or below. So say your income is higher than that, then you only become Medicare. But your income is below that, so then that's why you have a dual coverage, which is Medi-Medi. So in other words, basically anything in medical insurance is based on income. and
Income,
some of it
right.
on disability, but primarily it's based on income.
And it's important for people, I guess, of all ages to understand how these programs work. More so, especially if you're living with HIV, right?
Correct. Yes, you definitely want to know because, again, there are programs, and even though a good number of our clients fall under the Medi-Cal, there are people that work and need coverage that their employers do not pay for their insurance. So we
Yeah.
have programs that they can tap into it and also access insurance. And if they are within the bracket or the income line, their insurance will practically be paid.
Right. Well, that leads me to my next question, actually. So, what are my options, let's say, if I have private health insurance, but for whatever reason, my health insurance doesn't cover or pay the cost of my HIV care and treatment, which, as we know, can be very expensive?
Correct. So, through the state of California, there's a program called ADAP, which most of the HIV individuals qualify because the income for one person is 75,000 roughly, and as long as you're below that, you apply for that. So it covers your prescription coverage, all HIV meds. It covers your insurance. So every person has different type of insurance. Some are self-employed, and obviously insurance in California is expensive. So then they can qualify for the monthly premiums. Their insurance provided for employers, but then they might have a little bit of uh, coverage, not an entire coverage where they have very low premiums, my bad, copays. So then they still want to apply for that program because they have an excellent coverage. In addition to that, if they qualify for the premium assistance, there are some copays for doctor's visit, labs, some type of specialty care. So it's an excellent program, but again, it sounds redundant, but everything is based on income.
Everything's based on income. And we should say, talking of copays, the pharmaceutical companies also offer copay assistance to help if you've got some coverage and need to get over the line to get your treatment, don't they?
Correct. So then sometimes we'll say you're new to HIV and then you go to a doctor, and then if it's a medical private practice, they might not know about these programs because most of them are connected through social services. So sometimes they connect you through the pharmaceutical programs. They're called patient assistance program. And through that program, usually some of those programs give you, let's say, a year, 6 months, depending on each program. And they also connect you with the program that I was talking to you before, which is ADAP. And the idea is to link everybody to any resource they qualify.
So I guess what's also important to stress and amplify here, Javier, is that not having insurance, or perhaps or you're in a low income bracket, it shouldn't be a barrier for you seeking care or testing or treatment if for HIV, because there are systems and programs in place that will help get you into the care that you need to hopefully get you to undetectable and healthy. Am I right in saying that?
Correct. I think most of the time the challenges and barriers are people having a stable housing, having a job, and sometimes being new to a city where they're not aware of the services. But in general, it's fair enough to say that there are resources. And again, it's just getting to know them, navigate them. I usually tell people anything that they don't know, they can Google it, and that's the best way to start with. And then from there, maybe make some phone calls. But yeah,
Yeah.
so it's fair enough that there are plenty of resources. Some of the language may be a little confusing. That's why it's good to reach out to someone and get answers, and hopefully they access whatever services they're in need of.
Yeah, well, and if you're in Southern California in the Los Angeles area, I know APLA Health, where you work, is a great resource. If I generally want to find out more information about things like Medicare, Medicaid, and the process of that, what do you suggest is the best way? You mentioned Google, but are there any particular sites that you think that are good places for people to start?
Well, we usually ask people to, I mean, it's best to call us because sometimes the language is confusing and it's not meant to be, but it can be confusing. They can Google APLA
It
Health Benefits.
confuses me. I get
Exactly,
confused
no, and,
by
and
it.
and it would have confused me too because sometimes the language is just not as friendly. But maybe they can Google HIV services, APLA Health, benefits in California. And there are a few links in general, especially in LA, that will prompt you to access HIV services.
Yeah, and if you're watching this and you're not in LA or the California area, I'm sure the folks at APLA Health, if you did give them a call, would be able to perhaps point you in the direction of services that are within your area as well.
Correct. So, like the ADA program that I was mentioning is a state funded, so you don't have to be in LA. You can be anywhere in California, and then ADA is also in every state. How every state administers the program might be a little different, but my understanding that is practically reachable anywhere. And nowadays, people can do some of these services via web remote, so they don't necessarily have to be in person. So, especially for those that live in rural areas, it might be more challenging. They might not have the technology, but the idea is for them also to access it where they are.
Wonderful. Javier Perea from APLA Health, thank you so much for taking the time to walk through and talk through this with me. It's been a pleasure.
Likewise, thank you for having me.
That's going to do it for this episode of Plus Talk, where, as you know, we're all about turning positive into a plus. If you want more information, go to our website, pluslifemedia.com. And remember, you can like, follow, and share us across your favorite socials. We are at Plus Life Media. Until next time, be nice to one another. We'll see you soon. Bye-bye.